Now, recently we were asking you on our Facebook page about various ailments and things that you suffered on a regular basis and how often. And the biggest one that's come out is headaches and migraines. And one in particular, cluster headaches, which I have to say I'd never heard of. Got Dr. Chris with us this morning. Chloe Silverwood, Chris, says it's a serious and very debilitating condition with no cure, it seems. Amy Matthews, the most painful thing known to man. Sophie Mills, hi Sophie, said, my husband has suffered with cluster headaches for 5 years. It's ruined our lives. He's lost so many precious days and birthdays without us and his beautiful children. So this, I've never heard of them. Yeah,
I mean, it's not common. It affects about 1 in 1,000, but we've had this response because cluster headaches are severe, excruciatingly painful headaches, sometimes termed suicidal headaches. The headache is so intense, patients will bash their head against a wall. Now, let me just explain it. Cluster headaches, because they occur in clusters. You might get 1, 2, 3, 4 attacks a day, lasting 15, 30 minutes, but then they occur every day for weeks and even months. Then you go for months and have no headaches at all. Then they come back in a cluster. And I mean,
do you know the cause why people get
them? It's like migraine, you know, what is the cause? We know it's a disturbance of blood supply in the brain and a disturbance or imbalance of certain chemicals in the brain. But with the cluster headache, it comes on suddenly. It's severe. It's usually one-sided, and you get changes on that one side.
A migraine might be like all of those things as well.
Yeah, but the cluster is far more severe.
Really?
And of course, it's occurring, you know, 3 or 4 times a day, every day for months and months. Now, with the cluster headache, you get other signs. You can get a red eye, a watery eye, stuffy nose, blocked nose, flushing of one side of the face or sweating on one side of the face. So when the doctor hears the symptom, it are cluster headaches. Now, the problem with cluster headaches is that it may be triggered by alcohol, can be triggered by excess heat. So if you're exercising in a hot atmosphere, it can bring them on. Even solvents, petrols, perfumes could trigger, but everybody's different.
Okay. So how do you treat it then?
Now, this is it. Your paracetamols, your ibuprofen, they will not work at all, right? What you need to do, if these symptoms I'm describing sound like you go and see your GP, because the GP can treat you with a group of drugs called triptans. Now, triptans came out years ago for migraine. Now, triptans you can self-inject straight into the thigh. You can have a nasal spray or sublingual tablets, so they're very fast-acting, and they can help. Now, the GP could prescribe that, but you may be passed on to a specialist clinic where you may be given oxygen and other drugs that can control it.
Chris, just to get you through some of the other ones which are less specialist, these are called primary headaches, and one of which is a tension headache, self-explanatory.
Well, yeah, you know, the common garden headache, you know, about 70% of headaches are the tension-type headaches. Can be caused by stress, can be caused by just everything around you, bad posture in your chair.
But easily sorted.
Well, of course, what do? We treat ourselves with paracetamol and ibuprofen, and that usually does the trick. But a headache that's persisting, despite that form of treatment, needs to be checked out by your doctor.
So don't ignore a persistent headache every day and keeps coming back. And right, migraine, you mentioned, you threw in there, saying it could sometimes, people with cluster headaches might think it's migraine.
Yeah.
What's the difference?
Well,
so many people suffer.
Migraine is very common. 8 million sufferers in the country, and with migraine, you know, it's not just a headache. If you've not had migraine, it's just a headache.
Now, we've got Sarah Hardy here. She says, and Anna Lise Owens, migraines make me vomit and I get the shakes. It's not a headache like other people think. You get nausea, dizziness, numbness, disturbed vision. Mine can go on for days. It's absolutely exhausting.
That's it. She's describing some of the classic symptoms. And again, it's a severe pounding, throbbing headache, usually affecting one side. About 80% of sufferers, 80-90% get nausea, 20-30% get vomiting, and you dislike bright lights and loud noises.
But one of the factors is obviously recognising the trigger. If you can actually self-diagnose and recognising what brings this on, that's you're halfway
and you can
there.
do this. Just keep a diary. What was happening before I got those headaches? Everybody's heard about chocolate, cheese and red wine, but there are so many other factors as well. But you'll very often identify it, then you've got to try and remove it. Now, if you do get migraine, a simple thing is to start with soluble aspirin or soluble paracetamol, and an antiemetic, which stops you feeling sick and helps the drugs to work quicker, or move on to more effective treatments.
What about a hormone headache? We've been hearing about that as well, hormone headaches.
Yeah, well, especially in women, because of the cycle through the month with estrogens, etc. And of course, a lot of women get headaches premenstrually as part of the premenstrual syndrome, headaches in the menopause, headaches on the pill. Interesting that migraine can be improved during pregnancy.
Oh, really?
Pretty drastic
yeah,
treatment for your
it's very
migraine.
drastic treatment.
But you know, the changing levels of hormones have these powerful effects on the body.
But for hormone headache, is it just a normal...
Well, let's say you're on the pill and you get the headaches when you're on the pill-free days. You can take the pill continuously for a few months, and that can help it. Sometimes adding estrogen before or after a period can ease the hormone. And of course, for menopausal headaches, HRT would help.
What about something my wife suffers from greatly, selective headaches?
Is this to prevent you doing something? Or without saying anything?
Thank you.
I know, she develops them when it suits her. That's basically...
Woman's prerogative, I think.
And when I was a kid, I had a lot of headaches, and I realised it was through not drinking water.
Yeah.
Dehydration, yeah.
Oh, dehydration, yeah. You know, if it's hot and you've not been drinking, you know, your headache, you're feeling the tiredness and weakness could just be dehydration.
Heading footballs also contributed.
We'll put all the
Chris.
information on our website as well.